Our goal now is to help you assess the status of your pelvic floor muscles. I will readily admit this is not the easiest thing in the world for women to do. And if you're really having a tough time, I suggest going to the pelvic floor connection type exercises or seeking some help. This is what I do for women as part of my role as a physical therapy assistant, is that I give feedback of both how their pelvic floor is doing and then how to do these exercises. So there is help out there, but I totally think it's valuable for you to be able to try either the mirror exercise I'm going to show you for external assessment or the finger for internal assessment. Two things to think about before you try the assessment is your supplies and your position. So for supplies, you only need a hand mirror and some lubricant if you're doing the internal assessment. And positioning, this is a nice position where you're seated. You could have pillows around so that if you're, you could put those under your knees so that your hips are relaxed. Or if during the internal, you can't reach your vagina with your hands or it's very uncomfortable, you could prop up your hips or you could try this side lying position. So let's begin the external assessment of your pelvic floor. So as you inhale, I would say gently lengthen or bear down through your pelvic floor muscles like you're trying to push out gas. Or you can visualize that you're widening the area between your sit bones and gently moving your tailbone away from your pubic bone. So you should see in the mirror that your perineal body or the area between your vagina and rectum drop down towards the mirror. So again, where is that? So here's our pelvic model. Here's your pelvic floor underneath. So this is the area between the vagina and the rectum that you should see slightly, not a big move here, but you should see it come out towards the mirror. For the internal assessment, you're going to get yourself ready. So you could either have your washed hand or a glove, and you're going to place some lubricant around on your finger, your index finger. And you do not have to go very far in, but you're going to go in and you're going to assess. Can your finger even go in? Sometimes women will not even be able, they're so tight that they're not going to be able to have their finger enter without pain or a lot of tension. If you can have your finger go in, then you could assess by, you could do a Kegel, right? Do a contraction. And then, so that's going to be a squeezing around your finger. And then can you relax? Does do your vagina muscles let go of your finger? And what we will find is that, it either won't or it will take a long time to finally feel that relaxation and have your finger gently come out. So that's an internal assessment. So this is really where I feel like the benefit comes in from kind of pelvic floor physical therapy versus just starting to do Kegels, just based on, learning about a strengthening Kegel. The nuance of both understanding where you're starting and where you're going to, and really bringing in the relaxation first before you go into a strengthening Kegel. So when I think about if you need to do relaxation, is thinking about that you're going to look at this chart, which has 4 levels to it. And if you are not able to release your pelvic floor, which is level 1, then you keep going with the pelvic floor relaxation exercises, the prescription I'm going to describe next. If you're at level 2 and you're able to release the pelvic floor a little bit, continue with the pelvic floor relaxation exercises. Level 3, if you're able to release the pelvic floor, but not all the way and with some pain, continue with the pelvic floor relaxation exercises, but we might start to bring in some strengthening for you. And then level 4, if you're able to relax the pelvic floor completely and without pain, then you can start with the Kegel strengthening program. So here's the prescription I give to women who need to work on relaxing their pelvic floor muscles. So here is the pelvic floor muscle relaxation prescription. And what I suggest is that you do pelvic floor check-ins and relaxations. If your pelvic floor feels tight or clenched, you can try pelvic breathing. So remember, pelvic breathing is what we tried in the last lesson. This is where you connect with your breath, you get the diaphragmatic breathing going, and then you bring in the pelvis. That can calm you down and kind of start to move the pelvic floor muscles. The pelvic floor lengthening that we just went through, where you kind of have that bulge that comes, that you're bulging out for your pelvic floor. Or you can try the pelvic floor relaxation exercises that we're going to have in this lesson as well. How often? You want to practice this throughout the day. You don't want to allow a more than 8-hour, especially work day, to go by without releasing your pelvic floor. A nice place also is if you're driving in the car. This is a nice one to do at that stoplight kind of thing that sometimes women talk about doing in their Kegels. They can be used on the hour if you're experiencing a flare-up of pain until that pain subsides as well. In this lesson, you will find 3 pelvic floor muscle relaxation videos of different lengths and also kind of bringing in this relaxation through different imagery. So we have the 15-minute rose petal, we have the 10-minute child's pose, and the 5-minute side lying relaxation videos for your pelvic floor.